My name is Martika Martin. I work for Dan Howard Drugs in Owensboro, Kentucky. I decided to enroll in the NCPA Innovation Center CPESN Community Pharmacy Fellowship to kind of advance our practice. I'd got to a point where I wanted to implement new programs and take care of patients in different ways. I just needed the extra push to kind of get that started. The fellowship is different from other pharmacy training programs because of the hands-on learning and the more community involvement. It kind of creates a whole community of different peers that you can talk to, brainstorm with, and learn from. And the fellowship introduces you to pharmacists across the country in different boats, so it lets you really network and get to know those people. The fellowship has really made an impact in our pharmacy by improving workflow. We learned that to really implement these new services, you kind of got to start with the basics, MedSync, getting patients scheduled, and really implementing that appointment-based model so that way you can go on and advance and offer those other services. The NCPA Innovation Center CPESN Community Pharmacy Fellowship does a great job of connecting pharmacists across the nation to help improve the practice of pharmacy. My favorite part of the fellowship is really learning from the experts, people who have already done some of these things, and really getting their tips and tricks to kind of help, maybe avoid some of the mistakes or hardships they have or find new ways to get around some barriers. The leaders, they have tricks or things that they know that made things, 100 times easier. And it could be the simplest thing ever, but um, you may not think of it until someone tells you, like, well, why don't you try this? Main success that I've had as a result of the fellowship is really improving our MedSync and custom packaging program. We've almost, I believe, doubled the numbers of patients that are enrolled in these programs, which has really freed up the pharmacist's time to do other things and really take care of patients better. For pharmacists that are considering enrolling in the fellowship but haven't yet signed up, I would say take advantage of this opportunity. How often do you really get to talk with um, the innovators and leaders in the profession and learn from them and really get to pick their brain and connect with them? I believe the fellowship is a great opportunity for those that are wanting to advance their practice. Um, we're wanting to be providers, and to be healthcare providers, you've got to provide care, and this is really the next kind of stepping stone to get you prepared to do that.